Welcome! This explainer is built just for you, the phlebotomy student. We're going to connect the dots between the major body systems and the crucial tasks you perform every single day. You'll see how understanding a little physiology can take your skills to a whole new level of excellence. So let's start with what this is all about. Every single tube of blood you draw tells a story, a really important story about a patient's health, and it's your job to make sure that story is accurate right from the get-go. Your precision is literally the first line of defense against a mistake. Here's a quick look at our game plan. We're going to walk through the digestive, reproductive, urinary, and respiratory systems and really focus on the key rules for each. Then, we'll wrap it all up with the core principles that guide every single draw you'll ever do. Okay, let's dive right into the digestive system. You're about to see why what you do before and after the draw has such a massive impact on these kinds of test results. So the digestive system's main gig is turning food into fuel and nutrients. And because of that, whatever a patient eats and when they eat it directly messes with the levels of things in their blood, which we call analytes. This is exactly why your job of checking if they've been fasting is so important. Let's look at a few examples. For a lipase test, if a patient just had a big, fatty meal, their results could be falsely high, so fasting is a must. For liver enzymes like ALT and AST, we've got to spin that sample down fast. But check out bilirubin. This one's a big deal. It's incredibly sensitive to light. If you leave that sample sitting out on the counter, UV light will literally destroy the bilirubin, giving the doctor a falsely low result. Totally useless. And here is a fantastic tip for your exam. You might be drawing a gold top tube for liver enzymes, but a problem with how the body absorbs nutrients could show up somewhere completely different. For instance, if the body can't absorb vitamin B12, it messes with how red blood cells are made. You'd actually see that on a CBC from a lavender top tube. It's a perfect example of how all these systems are connected. Now, this slide shows a rule that is absolutely non-negotiable. You see that beautiful, clear sample? That's the goal. Now look at that other one, the reddish, kind of cherry-colored serum. That's a hemolyzed sample, meaning the red blood cells have burst open. All that extra stuff floating around will make results for tests like AST and potassium falsely high. There is no way to fix this. That sample has to be rejected, and you'll have to do a careful redraw. All right, let's switch gears to the reproductive system. For these tests, when you draw the blood can be just as important as how you draw it. Hormones fluctuate like crazy depending on the time of day and, for women, where they are in their menstrual cycle. So how do doctors use these results to play detective? It's actually pretty cool. Let's say a patient has low testosterone. The doctor's next move is to check the pituitary hormones, FSH and LH. Think of the pituitary as the manager and the gonads as the workers. If FSH and LH are high, it means the manager is yelling instructions, but the workers aren't listening. That's a problem with the gonads themselves. But if FSH and LH are low, well, the manager isn't even giving any orders. The problem is coming from the pituitary. This chart really drives home just how critical timing is. See testosterone, levels peak in the morning. That's why we have that strict 7 to 10 a.m. window for the draw. And for female hormones, you absolutely have to document the patient's cycle day. A result on day 3 tells a totally different story than the same exact result on day 21. So just to recap that little bit of detective work, which is definitely something you need to know, you can't just look at FSH and LH levels alone. High levels point towards the gonads, while low levels point upstream to the pituitary gland. Okay, next up is the urinary system. For both blood and urine tests that look at this system, your instructions to the patient and how you handle the sample are everything. It's the difference between an accurate result and a worthless one. The 24-hour urine collection is a procedure where your instructions are absolutely paramount. The whole process starts when the patient empties their bladder and gets rid of that first sample. That's what starts the clock. From that moment on, every single drop for the next 24 hours has to go into that container. If even one sample is missed, the whole test is invalid and you have to start all over again. This is a really key distinction. A dipstick might just say positive for blood, but we need to look under a microscope to get the real story. Are there actual whole red blood cells in there? We call that hematuria. Or did the red cells already burst, releasing their hemoglobin? That's hemoglobinuria. They look totally different and mean very different things medically. Okay, here's a rule to burn into your memory for your certification exam. Urine is unstable. You have a 2-hour window to get it processed or put it in the fridge. If you don't, bacteria start to grow and all the important little things like cells and casts will just break down, making the sample useless. And remember, you need a microscope to confirm true hematuria. Let's move on to the respiratory system. The samples you handle here, especially arterial blood gases, or ABGs, are some of the most critical and time-sensitive specimens in the entire hospital. Your technique can directly impact life or death decisions. Seriously. Preanalytical errors are the #1 cause of bad ABG results, so there are 3 things you absolutely must do. First, you have to get rid of any and all air bubbles. Room air has way more oxygen than blood, and it'll seep into your sample and mess it up. Second, you have to mix it gently but right away to prevent clots. And third, it has to get analyzed fast. The living blood cells in that syringe are still using up oxygen and making CO2, changing the very results you're trying to measure. Now, besides ABGs, when a patient is having trouble breathing, you will very likely be drawing a D-dimer test. This is a blood test that helps doctors rule out a serious blood clot, like one in the lungs, called a pulmonary embolism. And this slide shows you exactly why your technique for a D-dimer is so critical. You have to use a light blue top tube, and it has to be filled correctly. Why? Well, that tube contains a liquid anticoagulant, and it's designed for a super precise 9-to-1 ratio of blood to liquid. If you do a short draw like the one you see there, you throw that whole ratio off, and the result is completely invalid. That tube has to be rejected, and you have to do a recollect. Now, think about this. It's a common scenario. You've drawn a venous blood gas, or a VBG. A colleague asks if the doctor can use that result to check how well the patient is breathing and getting oxygen. Is that valid? What do you think? The answer is a hard no. And this is a huge safety point and something you are very likely to see on your exam. Venous blood is the blood coming back to the heart after the body's tissues have already used up all the oxygen, so it can't tell you anything about a patient's oxygenation status. For that, you need an arterial blood gas, period. Okay, let's bring it all home. It doesn't matter what system you're testing or what colored tube you're grabbing. These core principles of safety and accuracy apply every single time. These are your non-negotiables. First, always ID your patient with at least 2 identifiers. Second, always label your tubes right there at the bedside, after you draw, never before. Third, always follow the correct order of draw. Fourth, always put safety first. And finally, always communicate clearly. These aren't just suggestions. They are the absolute foundation of excellent patient care. So as we finish up, think about this. Which of these principles will you make your personal mantra? Maybe it's double-checking every single ID band no matter how busy you are. Or maybe it's making sure every single light blue top is filled perfectly. Choosing one of these to be your personal unwavering standard is the first and most important step to becoming a truly exceptional phlebotomist.